I want to share some tips today on how to manage competing demands during the pandemic from a public health perspective. Some of the challenges we faced early on were ensuring we had enough staff for our mass vaccination clinics and that we had enough vaccine supply to meet the demand. We were also dealing with a lot of vaccine misinformation in the community and lack of vaccine confidence. From a staffing perspective, we utilized multiple groups to help with the mass vaccination clinics, including volunteers from the university, both faculty and students, community organizations, local health departments, and others. Providing timely and adequate staff training was needed on a large scale, and we did this by a program called Just-in-Time Training. We recorded training videos, utilized video conferencing technology, and provided infographics to the staff. By recording detailed instructional manuals that could be downloaded and shared, staff could access these materials when needed. Another tip is to embrace potential partnerships that you may not have instinctively thought about, such as the health department or immunization coalition. It helps to engage those community partners, as we can't do it all ourselves. For example, we partnered with a group known as Team Rubicon, which is nationwide and helps people out during disasters. They were instrumental in providing additional resources to us. To address public concerns about immunizations, it's important to help the public understand the importance of preventive care and medicine. We did this by going into the community and meeting patients where they were, especially vulnerable populations who may have access issues. We provided care to the community by setting up mobile clinics at different locations, such as local community centers, senior centers, food pantries, and unique locations such as pop-up clinics at concerts and sporting events. We encouraged those who came to the mobile clinics to tell a friend about their experience and the availability of these services within their community. We also leveraged existing technology to help in our community outreach endeavor, such as our state immunization registry, which does vaccine forecasting for us. This was so helpful in thinking about the administration of other vaccines, as not every pharmacist has the time to assess CDC recommendations and determine which vaccines are needed. In closing, it's important to prioritize your efforts. Getting our population vaccinated against COVID-19 and influenza is the priority right now and should be our focus. If a pharmacist can't do a full vaccine assessment now, work on building the patient-provider relationship and encourage patients to come back for other vaccines. Become the preferred vaccine provider for your patients so they know you are there to meet all their long-term vaccination needs.